Hi friends, welcome to Medicoapps. In our today's masterclass, we'll learn about the hypoglossal nerve. Okay, so the hypoglossal nerve is the 12th cranial nerve. It is the 12th and the last cranial nerve, and it is a purely motor nerve. Okay, so its only function is to supply muscles of the tongue. So the nucleus of the hypoglossal nerve is present in the floor of the fourth ventricle, that is in the upper medulla towards the midline. Okay. So here is a diagram showing that. So here we have the hypoglossal nucleus in the floor of the fourth ventricle near the midline in the upper medulla. From there the nerve is passing anteriorly, and it exits from this area, that is between the pyramid anteriorly and the olive posteriorly. So here we have the olive that is posterior to this hypoglossal nerve, and we have the pyramid that is anterior to the hypoglossal nerve. Okay, once it exits from the medulla region, it passes through the hypoglossal canal in the posterior cranial fossa. And after it exits the hypoglossal canal, it goes and supplies the muscles of the tongue. It supplies the extrinsic and intrinsic muscles of the tongue. All intrinsic and extrinsic muscles except palatoglossus. Why not palatoglossus? Because palatoglossus is supplied by the vagoaccessory complex and not the hypoglossal nerve. Okay, so the nerve exits between the pyramid anteriorly and olive posteriorly. So let's see another diagram here. So here is an inferior aspect of the brain. This is where the hypoglossal nerve exits. Okay. So it exits the cranial cavity through the hypoglossal canal that is present in the posterior cranial fossa. Okay. After it exits from there, it passes downwards and ends up supplying the muscles of the tongue. Okay. Apart from the muscles of the tongue, some other muscles are also supplied. What are those muscles? So it supplies the geniohyoid and the thyrohyoid muscle also. Okay, some fibers from the C1 also join the hypoglossal nerve and form the superior root to the Ansa Cervicalis. We learn what Ansa Cervicalis is in the coming slides. Okay. Now let's talk about the genioglossus muscle. Okay, genioglossus muscle is a large fan-shaped muscle that forms the bulk of the tongue. Okay, so basically its function is aim. The mnemonic here is the aim. Remember aim. Aim means anterior movement, that is protrusion of the tongue. I is the inferior or depression of the tongue, and M is the medial movement of the tongue, that is towards the central portion. Okay, what do we mean by medial? It means that the left genioglossus muscle will move the tongue towards right or towards center, and the right one will move the tongue towards left. Okay, so the movement of the tongue is aided by genioglossus muscle, and to remember its function, remember the mnemonic aim. Okay, A for anterior movement, that is protrusion of tongue. I for inferior movement, that is the depression of the tongue, and M for medial movement, that is towards the center portion, that is towards the opposite side. Okay, now what happens when there is lesion of the hypoglossal nerve? Okay, so when the hypoglossal nerve lesion is present, the opposite side genioglossus becomes more powerful. Okay, for example, if there is lesion in the right hypoglossal nerve, the left will become more powerful, therefore the tongue will move towards the right. Okay, it's ipsilateral movement of the tongue. Now let's see that. Okay, therefore the tongue deviates to the side of the lesion, that is the ipsilateral movement of the tongue. Let's see a diagram here. So here we have right side and left side genioglossus muscle functioning together. So here when the lesion is on the right side, the tongue is moving towards right side, right? If there is lesion on the left side, then the tongue will move towards the left side, because the opposite genioglossus becomes more powerful and the ipsilateral genioglossus muscle is not functioning. Okay, so therefore the tongue deviates to the side of the lesion. Apart from the movement of the tongue being affected, the larynx is also affected. Okay, so if the hypoglossal nerve is affected, the larynx will move to the contralateral side, unlike the tongue that moves to the ipsilateral side. Why is that? It is because the hypoglossal nerve, apart from supplying the tongue muscles, it also supplies some strap muscles of the neck through the C1 fibers, right? So when that happens, even the C1 fibers will be affected. So when the lesion of hypoglossal nerve is present, even the C1 nerve fibers will be affected. Therefore, the strap muscles that were stabilizing the laryngeal cartilage in the center will be affected, thereby the larynx or the laryngeal cartilage will move to the opposite side. Okay, so if there is a right sided lesion of the hypoglossal nerve, then the larynx will move to the left side. Okay, because the right side laryngeal muscles that were supporting the laryngeal cartilages were not moving. So another fact you have to remember about the genioglossus muscle is that it is the safety muscle of tongue. It prevents the fallback of tongue. Okay, although genioglossus muscle is a skeletal muscle, it needs a drive from the midbrain to continue working. Okay, so what happens is that when the drive to genioglossus muscle is lost, that is in case of deep consciousness such as an epileptic attack, what happens is that the drive to this muscle is lost. Therefore, this muscle will fall back into the respiratory tube and cause blockage of airway. Okay, so this has to be prevented by first holding out the tongue and then protruding the muscle outwards. Okay, so the fallback of the tongue is prevented during epilepsy by holding the tongue and pulling it out, thereby preventing it from falling backwards into the respiratory tube. Okay, so even during sleep apnea, sometimes the fallback of the genioglossus muscle happens. Okay, why does it not happen during normal sleep is that the drive, or that is a deep consciousness, is not lost during regular sleep. Therefore, the tongue does not fall back. But in sleep apnea cases, the tongue tends to fall back. Okay, so the treatment to this, right now the only treatment possible is to increase the circumference of the respiratory tube. Okay, in theory, one more thing that can be done is that a pacemaker can be applied to the genioglossus muscle, thereby to prevent the fallback of the muscle even during loss of consciousness. Okay, so lots of studies are going on in this. It has not yet been developed, but it is being studied now. Okay, let's hope that it comes out sooner and we can have a pacemaker for the genioglossus muscle also. So we learnt about the Ansa Cervicalis, right? Now let's learn more about it in detail. What is it? Basically, it is nothing but a nerve loop supplying the anterior muscles of the neck. Okay, so it is a loop of nerve in the anterior neck supplying muscles of the neck. Here is an image. Okay, so this is the hypoglossal nerve that joins with the C1 root. Okay, so C1 root along with hypoglossal nerve supplies the superior root. This is the superior root of the Ansa cervicalis, and here we have C2 and C3 fibers forming the inferior root of the Ansa cervicalis. Okay, so we have C1 joining with hypoglossal forming the superior root, and we have C2 and C3 forming the inferior loop. So together C1, C2 and C3 form the Ansa cervicalis by some contribution of the hypoglossal nerve. Now let's see this in more detail. Okay, so let's label this diagram. So first we have the hypoglossal nerve, that is the 12th cranial nerve. Okay, so it joins with the C1 fibers here, and the hypoglossal nerve will end up supplying the tongue muscles, and along with C1 the fibers together will supply the thyrohyoid and the geniohyoid, and part of it will form the superior root of the Ansa cervicalis, and C2 and C3 together will form the inferior root. Let's label that now. Here is the inferior root that forms by the C2 and C3 fibers. Then we have the superior root that is formed by C1 and the hypoglossal nerve. Okay. So now the hypoglossal nerve supplies the tongue muscles except the palatoglossus, right? Except palatoglossus, all tongue muscles are supplied by hypoglossal nerve. Now along with C1, hypoglossal nerve supplies the geniohyoid and thyrohyoid muscles. Okay. And now the superior root and inferior root together will form the nerve loop, that is the Ansa Cervicalis, and supply the other strap muscles, that are the superior belly of omohyoid, sternothyroid muscle, sternohyoid muscle, and inferior belly of omohyoid. Okay, so except geniohyoid and thyrohyoid muscles, rest of the strap muscles are supplied by the Ansa cervicalis proper, that is the inferior and superior root of the Ansa cervicalis. Which are those muscles? We have superior belly, inferior belly of omohyoid, we have sternohyoid and sternothyroid muscles. Okay, so this is the Ansa cervicalis, that is the nerve loop that supplies the strap muscles in the anterior part of the neck. Okay, so to summarize, we have C1 along with hypoglossal nerve supplying geniohyoid and thyrohyoid muscles. We have C2, C3 forming the inferior root, and C1 along with hypoglossal forming the superior root. So together the superior root and inferior root form the Ansa cervicalis, supplying the inferior belly and superior belly of omohyoid, sternohyoid muscle and thyrohyoid muscles. Okay.